Artificial intelligence, a spooky combination of words. Soon there will be no medical doctors left. We will be taken care of by robots that will eventually become so smart that they will dominate the world. No, this video is not about science fiction. Instead, it is about a software that could help us shorten waiting lists to get to a medical doctor, be more precise in diagnosing cancer, and help us faster invent drugs. My name is Barbara, and today I'm saying hi to you from the oldest in Europe and arguably the oldest in the world, University of Bologna, where I study health economics. Today with this video, I would like to discuss with you the potential areas where artificial intelligence could be used in healthcare. But before we do that, I first of all would like to talk with you about what artificial intelligence is in the first place. People who work with it often use the phrase that artificial intelligence can learn. Let's first of all look, what do they mean when they say learn?
Imagine that if you plant a 1 apple tree this year, you will have 150 apples next year. If you plant 2 apple trees, you will have 250 apples. And if you plant 3 apple trees, you will have 350 apples. Now, if you were to plant 4 apple trees, how many apples would you have? If I'm not speaking too fast, by now most likely you have a formula in your head. That is, the number of apples equals the number of apple trees multiplied by 100 plus 50. If we were to give the same task for artificial intelligence, its deep learning algorithm would start to produce formulas. For example, apples equal the number of apple trees multiplied by 150. And indeed, that would be the case if we were to have 1 apple tree. 1 apple tree multiplied by 150, we have 150 apples, and that is the case that we gave to the algorithm. However, already in the second instance, if we multiply 2 apple trees by 150, we get 300 apples, and we know that is not correct. If we were to plant 2 apple trees, we would have 250 apples. And the algorithm, after checking that its formula doesn't predict correctly, would keep on generating different formulas until it derives one that suits all the 3 examples that we gave to the algorithm. That is, y equals x multiplied by 100 plus 50, because only this formula suits the 3 instances that we gave to the algorithm. And now with this formula we can predict that if we were to plant 4 apple trees, we would have 4 apple trees multiplied by 100 plus 50, 450 apples.
Sure thing. We don't need artificial intelligence to count apples or to derive formulas that are obvious to us. But now we understand what is behind the word learning. It's simply repeating and checking, or if we want to use a fancy vocabulary, iterating and testing. Thousands and thousands, millions and millions of times. When we have an example as simple as we just discussed, yes, 3-4 lines is enough, but of course we don't want to use the algorithm for something as simple as that. And for the more complex phenomena we use it, the more data we need it. So we can, for example, turn our apple trees into Facebook messages and our apples into the risk level that a person might commit a terroristic attack. The algorithm will need millions, trillions of data points to derive a formula that could predict precisely enough. But luckily or not, Facebook is full of messages. I don't even know the numbers, how they are named to describe the amount of messages that there are. Certainly, the usage of algorithm for such things has a lot of ethical and moral implications, which we will discuss more in the last part of this video. For now, let's concentrate on the healthcare. Diagnostics is a sensitive field in healthcare. First of all, misdiagnosing is the most common medical error. Second of all, it can mean an enormous burden on the healthcare system. For example, melanoma is a skin cancer that, unlike other cancers, can be observed simply on the skin without any devices. If you diagnose melanoma in the first stage, the survival rate is higher than 97%. But if melanoma is being diagnosed in the fourth stage, the survival rates are less than 10%. So no wonder in, for example, UK, that has a population of around 68 million people, 13 million people every year go to their family doctor and ask to check if what they observe on their skin, be it change of color or some new spots, is not a melanoma. Out of that 13 million people, 1 million is being sent to the dermatologist, because for the other 12 millions, already the family doctor could say that what they have is not melanoma. For that 1 million people, only for 15,000 people, melanoma is being diagnosed. That means to 1 out of 1,000 who inquired. This is an enormous burden on the healthcare system. And at the end of the day, we help only to 1 person out of 1,000. That's why a UK-based team found a solution. They designed a software and artificial intelligence that can read and diagnose pictures of skin and tell people if they have melanoma or not. Imagine how it is revolutionizing healthcare systems. Instead of first going to a family doctor, then to a dermatologist, then waiting for weeks for results and being stressed and anxious and not knowing what results will come out, instead you send pictures of your skin and you get the result that you don't have the cancer. Meanwhile, the doctors can spend time with the patients that will actually benefit from it, going deeper into their problems, making deeper analysis, instead of just trying to deal with as many patients as they can for the sake of just calming down and telling them that everything is fine with you. There are other softwares, such as, for example, ligands, that help speed up the processes but do not do the final job. So, for example, ligands helps cardiologists in doing their echocardiograms and shortening the time from, for example, 30 minutes to 5 minutes. Just imagine all the time that is now left for the doctor in his hands to spend with the patient and go deeper into their problems. If recently you have visited a medical doctor, most likely you were wondering what a pity it is to lose all this time with him or her while him or her are typing the information into the computer. Instead, you could have discussed in more depth the symptoms, the disease, the treatment, the prevention. That's why speech recognition algorithms, artificial intelligence, is expected to be the next explosion in healthcare. These are thousands and thousands of hours that could be saved and used for patients instead of just typing information into the computer. We do have speech recognition algorithms already, for example, Siri of iPhone. However, in healthcare, it's way more nuanced because each doctor has its own vocabulary. The things that a surgeon discusses might be very different than the ones that gynecologist or family doctor discusses. And so far we don't have a perfect enough algorithms that could really translate what the doctor says into the written text. We have briefly touched the most interesting areas in healthcare for artificial intelligence. However, it is only a surface of all the opportunities and possibilities that there are underneath. If you got more interested into these topics, in the description of the video, I leave links to podcasts and websites that for me look interesting and that could nurture your interest as well. I started this video by ironizing the fear of artificial intelligence, and yet using it raises an ethical and moral dilemma. Artificial intelligence itself is a software, which is neither bad nor good. The difference is that we don't know the formulas that the computer derives to come to the results. And yet that is not the biggest problem. The biggest question is, what data do we allow the algorithms to analyze? Are we okay our likes to be followed and according to that to be suggested a political advertising? Are we okay that our CV will be rejected by an algorithm when we are looking for a job? Are we okay to pay more because we are buying a flight ticket from an iPhone? These are questions to be answered by humans, not by algorithms. And we do have to have a thorough discussion on these questions. I would like to end this video with a quote of Marie Sklodowska-Curie, who said that the most important thing is not to fear, but to understand. And these are the times exactly for that. There is plenty of information in internet, different explanations, different approaches how to explain artificial intelligence. Look for them, try to find the one that is clear for you, and let's explore this journey together, because we would be surprised to realize how many times we already got in touch with artificial intelligence in our daily routines without even realizing it. I am impressed for you to have reached the end of this video. Thank you for that, and well, see you next time. Yeah.